No, it's okay.
Okay, history indications, and then we have kind of some blanky areas, and then we had, I think it says AOP here, AOM here, AOE, AOM, AOD, RIL, FIL, and then comments. I'm going to put comments over here just so we don't. Okay, so this first one we're going to do together. So I have a 54-year-old male with a AAA ordered for pain. What can we ask our patient?
How long have you had the pain for?
I've had the pain for 2 months.
Is it continuous pain or it comes and goes?
It's continuous.
Mm-hmm. From 1 to 10, how intensive is this pain?
6.
6 from 10.
Oh, I'm glad you asked. It's just between my belly button and my sternum.
Mm-hmm.
My tummy. My tummy hurts.
Does anything help or make it worse?
When I go to the bar and get shit-faced, it feels a lot better.
After
Don't
alcohol?
put that on your
Is it irradiate somewhere else or?
No.
Mm-hmm. Do you have other symptoms? Vomit, nausea, headache? No.
Have you had any other scans elsewhere? Any other CTs, etc.?
2 months. I do.
Have you had a surgery or procedure recently? You had high blood pressure?
I do.
What was the first I do that she asked?
Do I smoke?
Okay.
I'm a male. So, yeah, I just take it for fun. Do you have diabetes? No.
Hypertension.
She said yes.
Do you take any pills for your hypertension? How do you control it?
I don't.
So no medications at all?
Nope. Just my Flintstone vitamins.
Mm-hmm.
The occasional birth control pill.
But you're male. Why do you
I don't know. She asked me if I was on birth control, and I just said sometimes. I don't know.
Was there a particular onset or disease?
Pretty gradual.
What is about your work? Are you sitting in the office or you hard labor work? What is your work?
I'm a truck driver.
Mm-hmm.
You guys have nailed almost all of the things that I had to ask for patient history questions, but there's one you're missing.
Do you have family history of?
I'm gonna go mind reader. My father had an aneurysm and died when he was 70.
Mm-hmm.
Yes, we already determined that one. Yep.
What's your name?
I know we didn't put name. It doesn't matter. Leave the name. You can make up your own names. Doug.
Then do we ask them, have you eaten or drank anything?
No, I followed my AAA prep appropriately because I'm a very well behaved.
Good job.
Thank you.
So let's summarize so far. What are the important things?
Location?
Smoker, location of our pain,
How long?
family history, hypertension,
Age and sex,
age and gender,
gender.
and duration.
Mm-hmm.
Okay, so let's start with putting this on our business. So history. What's important about our history? What do we got here?
Father.
Father, the aneurysm.
So family history, so F important. Smoker, history of smoking. H/O, smoking. One thing you guys didn't ask. Oh, I started smoking yesterday.
How long?
30 years.
How much do you smoke?
Times 1 pack a day. How's that?
Mm.
Is that realistic? I don't really know what that's smoke. Is that realistic?
Realistic.
Some more, some less.
Okay. What else is considered history that is important?
Aneurysm. Oh, yeah.
We've done the aneurysm, but the family history of aneurysm, history of smoking times 30 years, 1 pack a day,
History of hypertension.
hypertension, HTN. And then one thing that you'll get into, you don't have to worry about this on your homework this week or whatever. Sometimes we have what's called uncontrolled hypertension. So in my case, I'm not using any medications, I have uncontrolled hypertension. So we might actually put uncontrolled hypertension. Okay, so why are we here today?
Pain.
What kind of pain?
Local.
Continuous pain.
Well, we don't really care about the continuous part. Where is it on my abdomen?
No.
Epigastric.
Epigastric?
Umbilical?
Umbilicus? It was between my umbilicus and my sternum. How about mid-abdominal?
Uh-huh.
That easy, yeah. Mid-abdominal pain times
2 months.
2 months. And then I made up something about drinking and wouldn't eat.
Yeah.
So mid-abdominal pain times 2 months. Okay. So we're going through. Now, when you guys do your homework in the real, like the next time, you'll actually take the measurements from your images and do your worksheet. But in this case, I gave you guys worksheet measurements. So we're scanning. We get AOP, which is 2.3 by 2.4. Then we get AO mid 6, oh my goodness, by 5.1. We're not quite done with him yet. Let's look at him. Oh no, what happened? Oh no! So we have 2 measurements. We're given the width measurement and we're also given the AP measurement. What are 2 other measurements we should take on this particular patient? Not necessarily the lumen size, the plaque thickness, and then
The length.
the length. So they kind of forgot to do that on this. So we are going to do it, and so we're going to get 6 by 5.1 by 8.2 centimeters. And then our plaque thickness is 1.2. We'll remember that here after this. We don't need to cut it. 6 by 5.1 by 8.2. We go back down to the distal, and we get 1.8 by 1.7. Iliac is 0.9 by 1.1. And I've got 1 by 1.2. Okay.
Now where's the plaque thickness go?
So, we're going to go in comments with it. But first, before we do our comments, you'll notice that this has a big blank area. This worksheet has a big blank area. Some of them are blank totally. They don't even have the aorta stuff in them. But sometimes we have to draw in our pathologies. Now, we're not trying to recreate ultrasound images. We're trying to show where this is in relation to anatomy on the aorta. So we're going to draw our little aorta in here. We're just trying to show, in relation to the anatomy, where this is. We're not trying to recreate these images. They're going to see these in our images. So I don't have to draw a plaque or whatever, or I don't have to draw like this. But I am going to draw, you my plaque in here. Now, we're gonna put some numeric values on this bad boy. So this guy measured 6 by 5.1 by 8.2 centimeters. And we still hold on to that thickness. Hold on to that thickness. We're not done with it yet. We want to give an idea of where it's at. And it's especially important to know where we're at in relation to the renals, right?
Subrenal.
Subrenal. Yep, you got it. Feeling cool so far?
We have to write subrenal somewhere or?
When we do our comments and when we talk to radiologists.
So 6 is in 1 in sagittal, 5.1 is in transverse, yeah.
Correct.
Why do we have to include about the renals?
So it's really important to note where, so if they have to graft this patient, they need to know whether they need to include the renals within the graft. Remember that graft we saw and it kind of splits and goes down the iliacs? So there's a different graft if the renals are involved. And so if it goes surgical, they have to know exactly where we're at. They don't get in there like, we have the wrong stents. Shea didn't tell us, for sure.
And those two on the side, are those the renal?
Those are my
arteries?
Yep. Okay, so for our comments, how are we going to describe this? Okay, what 2 things do we have going on right now? Plaque and aneurysm, right? So what's our magic word for plaque? Atherosclerosis and then aneurysm. But we aren't cool enough to use those words yet, so we're going to describe it. So, what do we have going on? Talk to me all about it.
Subrenal.
Even preceding that, do we have dilation of the mid-AO?
Yes.
So dilation of mid-AO, and then where were we in relation to the renal?
Subrenal.
Subrenal with, now we get to talk about our plaque. But we don't get to call it plaque. We don't get to call it atherosclerosis. What do we get to call it? Low level gray. Echogenesis is gonna be, yeah, we're gonna talk about its echogenesis. It's, remember, everything's hyper to the lumen of the aorta in IVC. So we can't use hyper or hypo. Those are more for tissue comparisons. So in this case, we have to say low level gray, mid level gray, echogenic, right? So what are we dealing with? Are we homogeneous or inhomogeneous?
Homogeneous.
Homogeneous, so dilation of the mid-aorta, subrenal with homogeneous. Are we going mid-level gray? I think so. Mid-level gray accumulation. Within lumen. Thickest, here it comes. Equals, what do we say, 1.2? The thickness of our plaque? 1.2. Thickest equals 1.2 centimeters. Do you think our patient was tender to scan?
Yes.
Tender to scan.
When we don't, when patient don't tend to scan.
I'll just say non-tender to scan.
No, when it's happened, when it's too small aneurysm, when we don't want to scan the patient.
Oh, we're scanning the patient.
Oh, all of them.
Yeah.
Okay, got
You
it.
just have to say, sorry. Yeah. Sorry, it hurts. Hang in there for a few minutes. Oh yeah, we got to scan them. Okay, so we have dilation of the mid-AO subrenal with homogeneous mid-level gray accumulation within the lumen. Thickest equals 1.2 centimeters, tender to scan.
And when we're writing these out, we don't abbreviate at all, or?
I don't know what AO is abbreviated.
Are we allowed to abbreviate it? Like actual?
Like the word aorta?
Yeah.
Yes.
Just AO or.
Yeah, but you wouldn't want to abbreviate like homogeneous and put homo, like, hey, there's
W.
Yep, W, yeah, yep,
Write
absolutely.
it out.
Like shorthand, yeah. You can do shorthand, like W or WO without,
Okay.
yeah, you
Okay.
can do that.
For homogeneous, can you do solid or no?
Pardon me?
Solid or no?
Solid?
For homogeneous?
Oh,
No,
no, because like solid's more like tissue. Is it solid
Okay.
tissue or is it complex
Yeah.
tissue? So this in case we know it's an accumulation, but if there was like an area of necrosis in it,
Mhm.
then we would say with an area of necrosis in the central portion or whatever, so. Okay, so, how are we feeling so far? Any questions so far? Now we have to do a RAD report, so flip your little papers over, or you can use a scratch paper, doesn't matter to me, but you will turn this in with your homework. So now we need to figure out a way to speak to the radiologist about this. So basically, we're gonna summarize our worksheet. We aren't gonna include any of the normal stuff, he doesn't care about normal, he just wants to know about the abnormal worksheet. So I have a 54-year-old male for a AAA exam. Family history of AAA, history of smoking times 30 years, a pack a day, and history of hypertension. Today he's presenting with mid-abdominal pain times 2 months. On the exam, we're going to skip all the normal stuff. On the exam, I noted dilation of the mid-aorta, subrenal, with homogeneous mid-level gray accumulation within the lumen, thickest measuring 1.2 centimeters, tender to skin. So it's everything we have in comments.
Can you say that again?
You flip over your paper, you already wrote it down.
It's everything you put in the comment.
Yep. Question?
How you worded the beginning and you were doing
Oh.
your measurements.
On exam, I found, what do you mean? This part? This part?
That part.
So I'm just gonna tell them, indications here for mid-abdominal pain times 2 months. On exam, I found dilation of the mid-aorta subrenal with homogeneous mid-level gray accumulation within the lumen, thickest at 1.2 centimeters.
So you're not writing the abnormal measurements for the aorta, just for the flag.
I could tell them that. I could say extending for a distance of 8.2 centimeters. That wouldn't be against the rules. We're trying to make this a little easier on you guys.
What's the thickest part for?
1.2. So that's like where, say I measured, like where this was thickest, is 1.2 centimeters.
Oh, the accumulation. Okay.
The accumulation thickness, yeah.
We don't need to make a picture for our doctor, like you did.
You will. You should have that on your worksheet.
What about in real world? Do we make some picture for doctor?
Yep.
Cool.
Yep. And I'll show you some of these other worksheets. They actually have like diagrams on them, and we have to put where our pathology is. So when I'm dealing with, for example, a pelvic patient, I have to put on the uterus where I found my pathology.
Uh-huh.
But this is a little bit of a unique exam type to learn with. It's the easiest one for you guys to learn how to scan, but it's one of the more challenging to write out. Whereas the other ones, like, we just write stuff down, and here's your measurements, but you have to draw for this one. And so it's a little bit more unusual than some of the other ones we're going to.
Could you point on the picture where is 8.2? How did you measure, like the thickness?
So we we made it up. 8.2 would be here.
So it's the length of the plaque,
Yep.
and that would be in sagittal, right?
Correct. Yep, so that would be like if we measured right here. Which they didn't do on this image. They didn't do two measurements. They didn't measure the overall length and they didn't measure the plaque thickness. Shame on them. Okay, how you feeling?
Pretty good, thank you.
Questions? So you'll turn this worksheet in, written on the back or on a different piece of paper, doesn't matter to me, is gonna be your radiologist report, what you would say to the radiologist. You're gonna have those images that you took in open lab that are absolutely not in a report card thing or report paper plastic thing, or I will throw it out my car window as I'm driving home. And then, your protocol notes. Okay?
Can we write our lab report? Can we write it out with our shorthand? But then.
As long as I can figure out what you're saying, yeah, that's fine, yeah. Yeah. Because out in the real world, I don't write them down, I just call them out. So it's just we're getting you to figure out what your dialogue would be.
We can just turn this one in for this.
Absolutely, that's why we did it together as a class, just so you know. Any other questions?